Okay, so welcome everybody. I'm very much delighted to be invited to speak at the Irish Cancer Society Conference 2020. I believe this is a new and welcome format, and I hope that what we can bring is a few interesting tools on living well with lymphedema. So to those present with lymphedema, I'm sure you don't need me to say what lymphedema is. To those at risk of lymphedema, we would say lymphedema is swelling of the interstitial fluid, and the difference between lymphedema and oedema is that this interstitial fluid is high in protein, and that is due to an impaired, one way or another, lymphatic system. Fortunately for secondary lymphedema, which is generally what's associated with surgery for cancer treatments, more refined surgical techniques means that we're probably seeing less lymphedema these days than we would have been even 20 years ago. However, there's always a risk. So for any surgery, whether it's for upper limb or lower limb, we know that any removal or sampling of lymph nodes with subsequent radiotherapy, there may be a heightened risk of developing secondary lymphedema. So I like sharing this slide with people so that it's always very interesting to see what is happening underneath the skin. So there's quite an active world underneath the skin, and I think if you can visualize what's underneath, what's happening within the lymph system, means that when we talk about movement or skincare or stretching, when you can see what's happening underneath, the two go together a little bit clearer. What we have here is a superficial network of initial lymph vessels. These are really delicate, really tiny, and they're smaller than the smaller capillaries. They are hooked in just in under the undersurface of the skin. They are incredibly responsive to movement or touch or stretch or breath. And so when these guys are moving, these are the part of the lymphatic system that are responsible for collecting fluid and any other unnecessary constituents in the connective tissue. These might be viruses, they might be bacteria, they could be dust or dye or tar from cigarettes, anything that's in the connective tissue that's unwanted. Literally everything that is picked up by the superficial initial vessels are dropped down into the deeper system, where everything that's collected by the initial lymph vessel and taken to the deeper system is delivered to the lymph node. And everything in the lymph node is either filtered or cleaned or concentrated, so that what's ultimately delivered back to the heart is delivered as a cleansed product. So there's quite a world in underneath the skin. And we're going to look at that in a little bit more detail, particularly when we're talking about skin care and exercise. So if we look at the two main purposes of the lymph system, it is to protect the body against infections and disease. And it does so by this little start of the system collecting and cleaning the connective tissue. And the other main purpose is to drain excess fluid and recall unwanted elements from the body's tissues. So we know that the lymph system doesn't have a pump, unlike the heart. So it needs us to move for it to move. So this is what happens when muscle squeezes against a collector or a lymph vessel. So this is what's happening on the outside of the vessel. Muscle is squeezing, and what's happening on the inside is the lymph is being propelled forward. So lymph, unlike the heart, doesn't have a pump, so it needs us to move for it to move. And lymph actually moves very, very slowly. It only moves 5 to 10 times a minute. And therefore, the type of movement that we incorporate into our daily activities enhance significantly the movement of lymph forward towards the lymph node, where it can be cleansed and filtered before taking everything to the heart as a cleansed product. So looking at the concept of muscle movement influencing lymph flow, if we consider lymph flow just like we saw within the lymph vessel, 5 to 10 times a minute, then the type of movement that we choose is what will enhance that lymph flow. So anything that has a stretching component to it, so yoga, walking, Pilates, swimming, stretching, rebounding, TheraBand work, all these movements are the movements that reflect the natural organic flow of lymph. Anything that makes your face red or makes your heart pump faster actually adds more fluid to the connective tissue. And when the lymph system is impaired one way or another, you're just adding more work for the lymph system to collect that fluid. Here we're going to be looking at some movement towards the end of this presentation that are quite easy. So very simple activities like stretching the calf, even if you're not particularly active and you have your feet up. So bringing the toes, as we say, toes to nose, toes to floor, putting something between the legs and squeezing. All of these movements enhance the flow of lymph. So we're going to take a little visual journey through the lymph system, through the skin. Here we have this initial lymph vessels tucked in just under the skin, ready and waiting to be responsive to movement of skin or breath work or stretching, collecting any unwanted particles from the skin, dropping them down by gravity. And these will be delivered to the deep system, all of which deliver their contents along with, this is the protein, along with water and hormones. Everything's delivered ultimately at the very end of the journey to the very active lymph node. So here we have many vessels delivering all its contents in one vessel to the lymph node. And here we mentioned at the lymph node, we have a lot of activity going on to cleanse, remove from the lymph before it's delivered to the heart anything that's not potentially a good product to be delivered. So everything that's good, like water and hormones and proteins, is filtered from the system and delivered directly by the heart. Anything that is not biodegradable, like tar or dust or dye, is actually kept within the lymph node. So looking at the concept of lymphedema, how do you know? So for those who are at risk, so if you've had lymph node dissection or lymph node sampling, and that could be anywhere within the regional lymph nodes, axilla, deep in the system, or the groin, how do you know that you have lymphedema? Well, we would say, so I'm working as a lymphedema therapist for 20 years, and I would certainly say that the concept of the patient being involved in their own care has really significantly enhanced in the last 5 or 7 years. What might have been considered anecdotal maybe 20 years ago is an integrative part of listening, us as therapists, listening to you as the patient. When you feel there's something that just doesn't feel right, I would say to you, that's a sign. Bring that conversation to your breast care team, to your surgical team. If it doesn't feel right, it's a sign. Listen to your own body. We may not be in a position to recognize changes such as circumferential measurements, but if you feel it doesn't feel right, that's a sign. And that would be a sign of potentially subclinical lymphedema. The ideal time for us to identify somebody at risk of lymphedema is at subclinical stages, because there will be something that may be happening for you that we can change, that can take it from being subclinical back rather than making subclinical to clinical. So always listen to your body. Don't be afraid to listen to your body and to share. So that might be to your team, your surgical team, your liaison nurse, to your GP. Again, just because we don't see it and we may not be able to measure the difference, if you feel that something is not right, do be sure and express those feelings. So what are we looking at as early signs of possible lymphedema? So certainly swelling of any part of the limb. It might be the arm, it might be the breast, it might be the trunk, it might be the leg, depending on the surgery. One thing that I would certainly say over the last 20 years is I feel we're seeing less lymphedema of the arm, given the more refined surgical techniques. But something that may get missed a little bit more is it may be a little bit temporary, but certainly more lymphedema of the breast. And that may be due to stronger radiation techniques. So you may feel the need to remove rings or jewelry or shoes, just feel that tightness in the extremity of the limb. You may feel a difference in how your clothes feel. You may feel a feeling of heaviness or tightness in the limb. Again, these are not measurable. So if you feel the difference, that's important to bring that to your team. You may have an ache or discomfort in the limb. There may be hardening of the skin. That would probably be a later stage when lymphedema has just gone unrecognized. So you may have a restricted range of motion, and this is something that often happens post-surgery, where you may not be able to reach to the height that you could have done prior to surgery, which may result in a small bit of oedema, or you may have recurring infections. So we're going to look at a few tools that will help to manage lymphedema. I would say certainly many of the tools we'll discuss are nothing that you need to buy, nothing that you need to invest in, but sometimes they're tools that we may have forgotten how to use. The first one of these is breath. We know that with the lymph system not having a pump, it needs us to move for it to move. And one of the best movements for us is knowing how to breathe. So breathing alone, it energizes, it cleanses, it purifies, and it uplifts us. A few full relaxed out breaths naturally help to release stress and engage the parasympathetic nervous system. When you engage the parasympathetic nervous system, it takes us out of that fight or flight place where we have a tendency to hold the breath. Breathing in through the nose lowers the tone of the sympathetic nervous system, and again, it reduces that sympathetic desire to breath hold. We breath hold when we tend to be in discomfort or pain or post-surgery. We may find ourselves in that breath holding place because we've just forgotten to release that breath post-surgery. One of the breathing techniques that is really, really, really effective to help move lymph is the abdominal breathing technique. And how that works is, it's literally a movement of the diaphragm. When you're breathing in, you're pushing out the tummy. When you're breathing out, you're actively pulling in the tummy. I know that these slides will be available for everybody to access following the conference. So I'm delighted to leave these visuals. And this little visual is accessible on this YouTube clip. Learning how to abdominally breathe enhances the flow of lymph up to where it delivers its lymph back at the heart. And all that's happening is that the diaphragm is being risen and actively lowered. And there's one vessel through which all the lymph from the lower limbs and all the abdominal cavity goes at the very back of the diaphragm and delivers its content into the heart. So learning to get comfortable with the diaphragmatic breathing is a really, really excellent tool. So other aspects of care of being able to live with lymphedema is skin care. Looking after the skin and knowing how to look after your compression and your compression garments and being measured correctly for your compression garments is absolutely essential. So let's look at skincare in the beginning. So the changes in the season not only affect, not alone affect the weather, it affects our skin. So when the seasons change, we should also change our skincare routine. In the winter, our skin will struggle more to stay hydrated, which means including richer oils and other hydrating products to your skincare routine. Properly exfoliated skin is more capable of absorbing your moisturizer. And if our skin is not exfoliated, creams do struggle to penetrate the skin and they just simply lie on top. So try to exfoliate with gentle products or even just with an exfoliating buff. And this removes dead skin cells from the body, leaving the skin invigorated, buffed and polished. More importantly, allowing the moisturizing effect of this cream to penetrate the skin. We know that the pH of the skin is approximately 5.5. Naturally, the skin has a mantle. It's called an acid mantle, which is about 5.5. The skin is one of the first protectors of the body. It's a semi-permeable a membrane which allows certain components to be absorbed through our skin. And so maintaining that acid mantle is important. So using moisturizers with a 5.5 pH helps with that. Things like Aveeno, E45, and creams that you can ask your pharmacist, do they have an acid pH of approximately 5.5. The LSN, which is the Lymphedema Support Network, have a number of really excellent fact sheets. These are easily accessible on the internet, and they have a particularly good one. I've just taken a screenshot of it here, of skin care for people with lymphedema. It's really, really excellent. And actually, I would encourage anybody to become a member of the Lymphedema Support Network. Just a little visual, why maintaining the permeability of the skin remains so important. So the skin, as we said, is the first defense. The skin is actually the largest organ of the body. And the skin being intact means that when it meets bacteria, look what happens. The bacteria just literally bounces off it like rain off a raincoat. So the intactness of the skin means that anything that we meet, it could be door handles, and certainly in this time when we're trying to protect ourselves from any invading viruses and bacteria, the permeability of the skin is really important. What happens when we don't have an intact skin? Something simple. I know this is a little bit dramatic using the knife, but the concept is the same, whether it's a paper cut, whether it's just whether it is whatever reason that the skin has broken, bacteria fall directly in under the skin and they overload the initial lymph vessel, which now needs to deal with an extra problematic issue if the lymphatic system, for some reason, post-surgery is dealing with more fluid than it needs to. With lymphedema, it would rather not have to deal with extra bacteria. One thing I would say for those at risk of lymphedema or with lymphedema and at risk of breaking the skin, a few nice tools. If you do break the skin, life goes on. Know to deal with it well. Clean the skin. Very nice product is the Savlon spray. Just clean the skin, spray the skin, and what the Savlon spray does is it creates a little seal until you're ready to deal with it, perhaps in a better setting. So if you have a significant break in the skin, always make sure any signs of infection that you do go to your GP and you maybe check, do you need an antibiotic? So looking at compression. So compression is another cornerstone in the care of lymphedema. So we know the four cornerstones tend to be skin care and movement, compression, and either MLD or self-lymph drainage. So looking at compression, the world of compression is completely varied. You can have compression that is bespokely made for you, such as this garment here, which would include fingers, It may not take in the whole arm because you may not have lymphedema of the whole arm. It will have silicone top bands. This means that the garments avoid slippage. You may have a light garment so that it's more of a supporting garment. There may be circumstances where you need lymphedema support or on both arms or legs. All of these garments that you're seeing can also be relevant to the lower limbs. You may have a wrap garment for somebody who may not be in this position. It may have arthritis, may not be able to pull on a garment, and therefore you have wrap systems. So compression should always be fitted by somebody who's trained, and it needs to suit your needs. So just to be sure that, you know, we're not borrowing garments, you're not lending garments, and you must always be measured for your garments. Garments are best worn when exercising. So I would say exercising or movement is one of the key components of you owning your lymphedema and your lymphedema not owning you. And for me, I would say, for somebody who's been working in the world of lymphedema for about 20 years, one of the beauty that I feel as a therapist that we can do is to educate about lymphedema, but to empower everybody to include movement to the best of your ability. So the movements, as mentioned, that sort of mirror the flow of lymph would be walking, swimming, cycling, tai chi, yoga, Pilates, dancing. All these movements are slow and they mirror the movement of lymph, but they also have a stretching component. We're going to look at it a little bit in more detail in aquatherapy, because the water world is a fantastic environment for anybody with lymphedema. So it's water for water. The environment of water is fantastic environment for various reasons for those with lymphedema. You may find yourself training with the Dragon Boat Clubs. They are fun, they're exciting, they winter train, and you find yourself including movement in a really fun environment. When you are including exercise, be sure to include slow warm-ups and cool warm-downs to minimize any muscle soreness. Always start conservatively. I'm going to follow this with 2 slides, which I won't talk through, but because again, the presentation is available to people afterwards, it's easy to download, and you can see where the limits of mild and moderate exercise come in. One thing, always remember, when exercising or using movement is to stay hydrated. I'd like to talk definitely more about aquatherapy. There are 2 forces when we're talking about aquatherapy and using movement in the water. One is buoyancy. The beauty of being in the water is that depending on the level of the water that you're standing in, for example, when you're at your knees, you weigh 50% of your body weight. Take that up to the chest level. Not everybody is comfortable to stand in water to your neck. Take that up to your chest level. You now weigh 25% of your body weight, because the water is taking 75% of your body weight. That means for anybody with lower limb lymphedema who may find it difficult to do exercise on land, the buoyancy force of the water is taking 75% of your body weight, which means you're only needing to use 25% physical strength to get the same movement that you would on land. The other incredible force of pressure of the water is hydrostatic pressure. Again, as you stand in water to your chest level, the higher the level of the water, the more the efficacy of the hydrostatic pressure. So when you're standing in water to your chest level, and you may have lower limb lymphedema, you are benefiting as if you are wearing a class 4 garment. That is because the hydrostatic pressure is pressing in. So any activity such as walking or cycling, you're doing this as if you're wearing a class 4 garment. Anybody with upper limb lymphedema, once the arms are in the water, you're benefiting from the hydrostatic pressure. I'm going to just include two little slides here, 2 little videos again, which are available on the internet. So for anybody with lower limb lymphedema, you can see walking, cycling, using a spaghetti to give you a little bit of buoyancy, not absolutely necessary, but the beauty of this is that it is, apologies, the beauty of that is that it is, buoyancy means it's lighter for you to move, and the fact that you're in water at your chest level means that you're getting the benefit of the hydrostatic pressure. Oops, apologies. And here we have just very nice movement of the, okay, very nice movement of the upper arms. Sorry about that, apologies. Okay, you can see you'll get to see these on on YouTube. This lady's name is Dara Tidar. She introduced the concept of aqualymphatic therapy, and really all that Dara is doing here, apologies on the slide, it's not working there for me, but that's okay. So she's just walking forward and rotating her shoulders. And certainly for anybody post-breast surgery, the beauty of walking and activity in the water means that the buoyancy effect of the water is taking the weight of the shoulder. And it's far easier to work in water than it is on land. These are very interesting little concepts. These are called clutch paddles. And these are clutch paddles that you attach onto the hand, and all they do is they increase resistance. So you can actually use the buoyancy as resistance when you're working. They're about €10. You can get them. They're a Speedo product, and very interesting. Again, if you look up the concept of clutch paddles on YouTube, and just again, have fun finding new moves. Nordic walking, it has just absolutely unlimited benefits for anybody with lymphedema. You'll see from the graphic, when you're using the Nordic walking poles, you are engaging the whole body. Fantastic for anybody with upper limb lymphedema or lower limb lymphedema. This is a little poster for a colleague of mine, Patricia Sutton, who lives in Limerick. And she has started walking groups called Nordic Walking Lymphoedema. And again, I'm delighted to include the slide, which you'll have access to afterwards, so that if anybody's interested in Nordic walking workshops, just to contact Patricia. Again, nice little slide here, just showing when you're Nordic walking, how much muscle activity you engage compared to other activities. This is Patricia, out on various environments, getting the best out of her Nordic walking poles. So these are two slides I won't talk through, but very nice guidelines on types of light and moderate and vigorous exercises to suit your needs. Again, I'm not going to talk through these, but I'm delighted to leave the very fact that they're accessible means that you can access these in words. These are easy exercises. When you're exercising, always wear your sleeve. So 3 nice suggested exercises: sitting or lying, using a light weight. Weights are easily accessible now through any sports shop, but actually even simply using a half-litre bottle of water means you have half a kilo in your hand. Let's talk more about lymphedema. Let's talk more about lymphedema, help create a greater awareness of its impact on quality of life. I'm delighted to leave this slide, which is a wonderful book for anybody working in the world of lymphedema and also for any patient. It's called Let's Talk Lymphedema, and it's by Professor Peter Mortimer and Gemma Levine. I'm going to leave you with some interesting websites, and with that, I know we're opening at 3:30, and thank you for your attention. Open to any questions.
Thank you very much, Maeve. That was a really comprehensive look at and overview of lymphedema, and really interesting as well about, I suppose just to say myself, I work in the Cancer Society, I coordinate our survivor support and volunteer programs. So I would talk to lots of patients and have over the years and listen to them who've had lymphedema. And I think a huge piece for me that I took out of it was that, you know, listening to your body is really important, that you're the expert on you, and that,
100%.
you know, yeah, and that as you know, timing is everything. So if you're feeling something, maybe talk about it. If you feel it, talk about it.
Absolutely.
I think that's a really good take. Now we just have some questions from some of the lovely people who are at our workshop. The first question, I think it's really important, from Marjorie, was that she was just checking that we still have MLD therapists, manual lymph drainage therapists, still working in Dublin, and I would say specifically all over the country as well. Because of, and notwithstanding because of COVID, and just to make sure that we can answer that and saying, you know, are the services still up and running, Maeve?
So I suppose there's no global service. I mean, certainly from maybe MLD therapists that are working in the hospitals, I would imagine it's up to each hospital's protocol. Certainly we're back working, and you might find that treatment time might be a little bit more limited, but I don't see reasons why services shouldn't be up and running. I certainly know it's been a problem and that patients have been at a loss without treatment. So I'm guessing it's each hospital needing to make their own policy choice.
Okay, so maybe check with your team, Maeve.
Sure.
Is that the best?
Yeah.
Okay. And indeed, with our nurse line on 1-800-200-700.
Yeah,
I think,
absolutely.
Yeah, or one of our daffodil centres in the Cancer Society. As well as that, we have a question from Genevieve saying, should she wear her leg compression at night? And in general, should people do that?
No, absolutely not. So the whole point about compression at night and taking compression off is two things. One, the fact that you're lying flat means that the gravity pull is not, you're not now pulling, so the tissues are not pulling against gravity. So when you're lying flat, the flow of lymph and the flow of the heart is on an even keel, like a river that's flowing with no gravity. The other reason, and so you don't need, you're not combating gravity. The other important reason for not wearing compression at night is because the skin needs to breathe. Compression needs to be removed, skin needs to be creamed, cream needs to absorb, and the skin needs to breathe. And because you see, if you leave it on overnight, what do? Do you wear it again during the day? What you'll find is that we change our skin cells, our superficial skin cells, every 3 days. And what happens is that if the garments are not removed and washed, is that that 3-day skin renewal, it finds itself into the knit of the garment, and it changes the efficacy of the garment. And that comes then to the second point of taking garments off at night. The more you wash the garment, the more effective the garment is. Because when you wash the garment, the elastin of the garment rebounds to its original place. So you're ridding it of shedded skin cells, and you're also enhancing the elastin of the fiber to rebound. So that's the other reason for taking the garments off at night.
Okay, thanks so much, Maeve. That's really brilliant advice there. We have a question from Jackie. She has has lymphedema in her breast, and she's wearing a compression bra, which has been prescribed by her lymphedema nurse. But she's wondering, is it normal to get a pocket of fluid under her breast, not near the scarring?
Okay, that is a really good question. So for lymphedema of the breast, and I think we mentioned we're probably seeing more lymphedema of the breast, probably because of the more refined lymph node surgery, but actually very often more targeted radiotherapy. So the bespoke garments, like the Lymphoedema garments, the Lymphoedema bras, the first and foremost thing, and I'm delighted to hear that she's wearing a bespoke garment or a bra recommended by her therapist. That's the first thing anybody with oedema of the breast will benefit from. It's the equivalent of wearing a good sleeve. It is, so to get a pocket of fluid is quite common. And what you'll find is very often just to make sure, what I see an awful lot of is make sure that the band of the bra is not too tight. Very often, I would say 3 out of 4, I would very often see the need. If you can loosen the bra at the back and it doesn't influence the support on the cup, and you still have space, I'll often find a span of space whereby the bra needs an extender. So if you can add an extender, and what happens is that, you see, lymph flows up and down. So if the bra, sort of the bra, not the bra strap, but the tie at the back is too tight, what it's doing is it's like wearing a tight belt. So what it's doing, it's creating a little bit of tightness below. You might have a surgical line here, and that's very often where you'll get a pocket. Women often find that there's an accumulation of fluid here, and it sort of gets in their way. So that's the first thing I would say, is just make sure that the bra strap itself isn't too tight at the back. See, does it need an expander? And the other thing I would say is, very often the bra companies, I'd love to have said Debenhams, but of course they're closed. So the bra companies will also, if you are heavy-breasted, or if you're suffering from oedema in the breast, excuse me, post-radiation, excuse me, look for a disc which sits into the bra strap. And what that does is it distributes the weight of the breast. So very often you might find that the bra strap itself is heavy under the weight of the breast. So 2 things can highly recommend with a good fitting bra: an extender if necessary, and a disc which distributes the weight of the breast on the cup. Is that okay?
Okay. Thanks, brilliant. Thanks so much, Maeve. And we have a question, maybe this is our second last question, maybe we have a question from Carmel, and she's exercising by swimming 5 days a week. She has arm lymphedema, and she's just wondering if that's too much, or...
So I would say, so exercising 5 days a week, 5 days, and is it too much? I would say nothing's really too much if it's not too much for you. What I would do is I would vary it. So I would modify the stroke, because when you modify the stroke, you're modifying your range of motion. So if you might do breast, you might do overarm, you might do backstroke. And the other thing to include is punching the water, because punching the water gets the limb into the water deep. So I suppose that's the one thing I would say, rather than, we always have to be careful of repetition and not repetitive strain.
Okay, so mix it up a bit.
Mix it up a bit.
That exercise. Mix it up a bit. Okay, and our last question for you, Maeve. We have a lady, Clodagh, who's in Sligo. I just see her question coming up there. And she hasn't heard anything from her lymphedema services for about 6 months. It's been 6 months apart, her appointments. So I suppose it's really checking on that, but also just looking at where is the best place to get information about lymphedema services and what's in your area. And as I said, our nurse line, cancer nurse line, is certainly a good place to do that as well. Cancer.ie or 1-800-200-700. But have you any more information on that, Maeve?
So one of the slides, the last slide here, you'll see I've left some interesting, useful websites. So one of the websites here is MLD Ireland, which is the MLD Therapist Association. So you might find that a lot of the therapists on the website are private, but what you'll find is that if somebody hasn't been able to access their public service, very often the HSE might fund therapy to a private therapist while they're waiting for their public service to get back up running.
Okay.
And the way to access that is just go on the website, click on the map of Ireland, click on your area, and see who is in your area. My contact details are also there, and I'm very happy to link in with anybody.
Thank you so much, Maeve, and thanks everyone for attending. It's a brilliant workshop, and I hope everybody else enjoys the rest of our conference. Thanks, Maeve. Take care.
You're most welcome. Thank you very much.
Bye. Bye-bye.
Bye-bye. Thank you. Thanks a million. Sorry about that.